Well, children under 5 years will for the first time be vaccinated against malaria from May 1 under the pilot malaria vaccine implementation program. In the following report, AC Benewa Otu engaged participants in the clinical trials at Kintampo in the Bono East region.
Ghana is among 10 African countries contributing 80% of global malaria burden, according to the 2018 World Health Organization malaria report, causing about 2,000 deaths annually, of which approximately 48% afflict children under the age of 5. Although strategies have been used in the past to reduce infection, little has been achieved. 30 years ago, the processes to get a vaccine as an addition to existing intervention began, with clinical trials in Ghana, Kenya and Malawi. This is the Kintampo Health Research Center. Over the years, the center has conducted clinical trials into vaccines and drugs of public health interest. Between 2006 and 2013, the center conducted phase 2 and 3 trials of the malaria vaccines among children. The vaccine is ready to be used here in Ghana, together with 2 other African countries. What does that mean for the center and the people who were part of the whole process?
In 2005, we applied to be part of the African scientists that were to conduct malaria vaccine trials in Africa. Luckily, we were selected, and then we started the early phases of the trial.
This is a vaccination center where more than 1,000 children were recruited within Kintampo Township for the vaccine trials.
We enrolled 2 cohorts of children, 6 to 12 weeks old and 5 to 17 months old. So what we found was among 5 to 17 months, the vaccine efficacy was 47% after following them up for 48 months. For 6 to 12 weeks, it was 27. We did follow them up for the same period, 48 months. Based on this, we have shared the results, and the European Medical Agency and other regulatory authorities have approved the vaccine.
This baby was the first malaria vaccine trial participant. From the vaccination center, samples were sent to the laboratory.
After all the necessary being done at the clinic, then their blood sample is taken, and then this blood sample are brought over here, and then the smear are done, and then we have to look at it as whether the person that have been vaccinated is truly not having the malaria parasite, or those that have not been vaccinated, whether they are having the malaria parasite in their system or they are not having malaria parasite in their system.
The vaccine trials did not come without challenges.
There were some misconceptions about blood draw in the communities. We did take a lot of blood samples so that I can make analysis to look at the safety issues. So some have issues. Some withdraw, but I might say few number of them, less than about 2%, did withdraw because of the blood issue. The other challenge is once we were looking at the safety issues, even if within 12 midnight, if a child falls sick and a field worker in the community calls you, we had to pick up those children from the community.
The news team followed up to Babatokuma, one of the communities where children were recruited for the study. Hakim Al-Hassan was 6 weeks when his parents consented on his behalf to be part of the trials. Hakim is now 12 years.
Hakim used to suffer from malaria, but not anymore.
Sheila, also 12 years, participated in the trials at 6 weeks. Her mother is excited her daughter took part in the process that would inform national policy.
Malaria no. Malaria
I was encouraged to allow my daughter participate because she was always sick of malaria. Her situation has changed now, and I'm excited about the outcome of the vaccine.
Workers involved in the study are also excited about the outcome.
Today, we are very excited about it. It's being piloted in Ghana, way beyond the communities in which this vaccine was investigated in Kintampo.
This is the first malaria vaccine in the world, and participating in the various phases to get to this level, I think that's great. That's a good achievement.
Being a key player in terms of malaria diagnosis, and finally seeing this vaccine being piloted, being introduced into our system to help keep these malaria challenges that we're facing. I think I'm so happy.
Because of the role we have played, we continue to be part of this scheme where Ghana, Malawi, and Kenya are the first 3 countries in Africa who are going to pilot the introduction of the vaccine. So right from its onset in introducing it to human, we have played a critical role, and we keep doing that even in the post-marketing phase to make sure that we contribute to the health of Ghanaians and Africans.
The vision of a malaria vaccine is definitely good news, as beneficiaries are expected to be immune from the disease for up to 7 years if administered 4 times, once a month for 3 months, and then a 4th dose 18 months later. AC Benewa O2 TV3 News, Kintampo.